People's first impressions of health psychology is it's something which obviously would only operate within a hospital setting. So very much akin to a clinical psychologist, you would be sitting there with a patient and you would be using CBT or some other intervention to work with a patient. But it's a much broader sort of range of things that a person might engage in.
We have health psychologists in government now advising government. So if you think about a lot of where the government money is going to, it's going in health promotion. So things like smoking cessation campaigns, reducing your alcohol intake, even wearing a seatbelt. And these are all areas that health psychologists are interested in designing interventions to help people with their healthy behaviours. Increasingly, we're finding the NHS is advertising more for health psychologists as they understand what the role of a health psychologist is. And the government has got an interest in increasing psychological therapies to patients as well.
Other people may work within the private sector. So some people might find themselves in the biomedical field that's opening up these days in terms of companies getting engaged in health behaviour change. So it's a very important thing. We have a massive health problem in this country, and a lot of it's down to our lifestyles. And a lot of the things that health psychologists might engage in is actually helping to shape and change health behaviours amongst people. And apart from the NHS, there's a lot of commercial interest in that side of things.
I think some of the skills that I've learnt on the MSc will be really applicable to clinical psychology. First of all, understanding how to interact with different target groups or different patients that you're dealing with or clients that you're working with, and understanding that there's a difference between, say, medical language and psychological language versus what somebody understands. I think those are really key communication skills that I can take with me.
The course is very much about increasing employability skills. So we've got an increased emphasis on that. So we try to send our students away with skills in presentations, for example, particularly presenting to different audiences. So it's not just about presenting in an academic way, but being able to talk to patients as well in a language that they would understand. The course is taught by registered and practitioner health psychologists, and we're very lucky to have a suite here, the health suite, with lots of different psychology labs. We've got a stress lab, neuroendocrinology lab, so we've got those sorts of research.
When we started the course, one of the fundamental things we wanted to embed people within an environment where they could actually have access to really cutting edge sort of approaches to investigating disease processes and also the impact of interventions. So we have a very highly developed sort of cardiovascular laboratory set up here where we use cutting edge resources, things that you won't find access to in older facilities. So we have things like impedance cardiography, we've got continuous blood pressure measurement, and then if we have neuroendocrine labs where we can collect large numbers of samples for saliva, urine samples, those sorts of things. And we can use those to index people's neuroendocrine responses to their lifestyles, their stresses and strains that they're happening in their daily lives, and see how those sort of patterns of responding may be actually contributing to disease processes.
Using the facilities within the course, it did help to understand aspects of how a patient or a client might view having an experience of having electrodes attached to them, and how you can actually soften that, and actually there might be some anxiety around that, and how psychology can help with those kind of things. I just feel that the whole course was very applicable on lots of levels, not just academic.
These days we're even moving away from these big high-tech things into using things like smartphone apps for biometric applications. So I have a lot of my students these days using their smartphones or using their participants' smartphones in studies to actually collect massive amounts of data and then feed it back through their smartphone.
The course attracts a wide variety of students. They're very dynamic and interesting backgrounds. So we have some people who come as mature students who might have had careers in health industry. And we also have people who come straight from our undergraduate degree. We do an undergraduate route in health psychology as well.
We've got students who are now currently working in the NHS, either as assistant psychologists looking to get onto stage 2 training or to get onto clinical psychology. We've got students who are already training as clinical psychologists, and we've got others who are now practitioners within the NHS. So within the realm of the NHS, we have people working at all the different levels, and they're competing in a highly competitive field where hundreds of people may be competing for the same job, and yet other students are successfully entering into that market.